No one knows what the future holds, but we can take what we've learned during the pandemic to prepare buildings for future conditions, including health emergencies and natural disasters. The Johnson Controls Flexible Facilities Solution modernizes critical building systems with pre-designed operating strategies and equipment configurations that adapt to new requirements so you can keep your staff and visitors safe and healthy regardless of conditions. So what does that look like? Let's give an example using an urban multi-purpose healthcare campus. Midnight. It's Monday at the WJ Healthcare campus. COVID-19 cases have started to re-escalate, and the main acute care tower is being stretched to capacity as new cases are expected to continue to increase. Meanwhile, the nearby empty medical office space and standalone urgent care clinic is ventilated at a reduced rate, while disinfectant lighting continues to help disinfect the air in exam rooms, waiting areas, and other spaces. 5 a.m. The control system increases outdoor air and exhaust air to maximum flow rates. It also increases room humidity, which reduces the transfer of the coronavirus. 6 a.m. The control system starts to bring room temperatures back to normal conditions for occupancy. 7 a.m. A severe tropical storm is approaching the facility, and the local utility is warning of potential grid outages due to heavy winds. The facilities manager checks the backup generator testing and maintenance compliance report to confirm readiness and prepare the main hospital to operate on emergency standby power. The solar PV and electric battery system, which normally operate to improve sustainability and maximize utility incentives, will instead be used to improve resiliency during a potential grid outage. 8 a.m. Clinicians are arriving at the medical office building, and the urgent care clinic has started accepting patients. They are screened at entrances with thermal scanning cameras. Anyone with an elevated skin temperature waits for 20 minutes in a nearby isolation room, maintaining negative pressure to avoid infecting others. If a second temperature measurement indicates a fever, the patient is transferred to the hospital ER intake for further evaluation. 10 a.m. The ER is overflowing, and beds in the ICU and general care floors are at capacity. The need to address both COVID positive and non-COVID positive patients is at risk of overwhelming the main building and spreading the virus to patients needing care for other conditions such as broken arms and diabetic complications. The facility notifies the urgent care clinic that it is being converted into a triage unit to evaluate all incoming patients. 11 a.m. The facility manager has initiated a new control mode, converting the clinic into a triage space with exam rooms now highly ventilated, filtered, and negative pressure isolation rooms. Patients that are tested and confirmed with COVID-19 are transferred to the ER, while non-viral and non-acute conditions are sent to the medical office building, which is also operating under increased air filtration and ventilation. 1 p.m. As the storm approaches and winds pick up, the electric grid goes out, and the hospital switches to backup power generation, which maintains power for critical services such as HVAC, lighting, and medical equipment. 3 p.m. As clinicians are treating patients, hospital center administration sees the increasing COVID-19 cases, putting further pressure on finances. Leadership is meeting in the boardroom to discuss how to leverage federal stimulus funding to implement ASHRAE and CDC guidelines for additional non-acute care ambulatory facilities to upgrade mechanical systems and controls to increase patient safety, increase energy efficiency, reduce costs, and improve resiliency. 5 p.m. The electric grid comes back on as winds from the storm die down. The demand reduction sequence is canceled, and normal power is restored. 8 p.m. The healthcare system continues to be pressured to keep up with the inflow of patients. The administration notified the nearby college that they will need access to its quarantine-prepared dorms to handle overflow non-acute patients. Luckily, the university has modified their HVAC systems and implemented flexible environmental control strategies to be able to quickly and safely accommodate those patients. This is just one example of how the Flexible Facilities Solution can help healthcare buildings implement rapid infrastructure renewal to assure safe, efficient, and resilient operations and flexible emergency response. Johnson Controls, the power behind your mission.